Hello, I am Stacey and as part of my graduate program, I've been asked to discuss my nursing philosophy. In pondering over this project, I've reflected back on my years as a nurse, both as a bedside nurse and as well as a manager, which is my current role. And my philosophy has changed as I've grown in my career, but the core values and the core philosophies that I've started with as a bedside nurse have just continued to progress and evolve and taken on new meanings as I've worked into that leadership role. Um, and so I'm getting this video to you guys from my house, and you can see there's a set of crutches in the background. And so I have also become the patient here in the last couple of weeks due to an extravagant injury on a vacation in Guam. And so if you want that full story, I'd be happy to show you that GoPro video. I can post that on YouTube. It's probably more entertaining than this one might be. But let's get into the nursing philosophy of Stacey. So I always think of things in simple terms to start with. And so my philosophy starts with my head, it moves to my heart, and then goes out to my hands. In my head, I say that's the integrity part of who I am as a nurse. When you look at the definition of integrity, it's being honest and having strong moral principles. And that covers just so many things to start with. But as that frontline bedside nurse, I want to do the best thing for my patient. I want to have the highest integrity with my practice and with my words and how I interact with them as a patient and their families. And when I look at that as the leader, it's doing what I need to do for my team. You know, do what I say I'm going to do and say what I really mean. And knowing that my staff can have full trust in me as their leader, that I'm going to do those things. And it's not just something that's said in a meeting or said behind closed doors and it never goes into practice. And part of integrity is admitting when you're wrong and having that humility to say, yeah, didn't get that one right, but I'm learning and growing from that, and saying a wholehearted apology and asking for forgiveness and acceptance for the wrongs, and, you know, working to not do those things again in the future. And the other part of integrity is to speak up for others. And whether, again, that's my patients, my nursing team, my support team, or my providers, I want to make sure that I am extending that integrity to them and speaking up for them in situations that need my advocacy. Because part of being a nurse is being an advocate, not only for ourselves, but for the practice and for the patients. As I move into the heart of my nursing philosophy, I chose the word compassion. And the definition of compassion, one of my family is sympathetic consciousness of others' distress, together with a desire to alleviate it. And I think that's nursing all around. Whatever practice of nursing you're in, you have a genuine consciousness of others' pain and suffering. Whether it's an emotional pain, a physical pain, a psychological pain, you want to address that and make it better. We're all fixers when it comes to nursing. And so I want to make sure I continue with that passion for my patients. In my world, it was obstetrics, and it still is obstetrics. And so that compassion is for where they are in that labor process. And whether that's with excitement and joy or fear and stress, meeting them where they are, and we're helping them to work through that. And that compassion has now morphed as a leader into my peers and seeing where they are in their nursing career. I have brand new nurses that are just so excited to be part of this amazing career, and so nurturing and fostering those new ideas and struggles. And I've got gals that are right where I am in that 15 to 20 year window of a nurse, and finding that niche and keeping us excited about our field and why we started this career and where we want to go with it. And then for those gals that I just adore, I call them my seasoned nurses, who I learn and grow from every day through their laughter, their compassion, and their understanding, and they are helping me to grow as a leader and supporting me. So it's working through any of those struggles, and then all the great successes that come with leadership. And so whether the personal ones, the babies, the marriages, the new houses, and then the career ones that are at sea, getting their bachelor's or moving up in their field and being able to maybe be my peer in a leadership role. And so always keeping that heart focused and not just in the head. And finally, when I look at my hands, and for me, that's hard work, 110% all the time, whether I want to be there or not. I attended a conference recently, and he said, start your day with a song and some motivational song. And if you need to do a power pose before you get out that door, look at yourself in the mirror and say, you've got this, you can do this, and you're going to be a great leader because you step off that elevator onto your floor and everybody's looking at you. And if you personify that hard work, that dedication, that we're going to make this happen regardless of what the situation is, your team feels that. And I want them to know that I always have their back, and I'm never going to ask them to work harder than I am, and that they want them to dream big when they're doing that hard work. And I want to support those, and I hope to try to make them understand that I want to be the good that I want to see in others, and just role model those great things that can happen when you really do put in the time and the effort. And BJ Griffith has a great quote that I love: hard work doesn't guarantee success, but it improves its chances. And so I always want to make sure my hands are doing not only hard work, but good work and productive work, and that's sometimes challenging in a leadership role. And I think overall, my nursing philosophy is going to continue to grow and change, just the way my career has grown and changed. And I'm always learning, whether it's this formal education that I'm in right now, whether it's those aha moments that you have over a cup of coffee or at a conference, a seminar, or those hard knock lessons, and those crutches symbolize a way of saying, slow down, take it easy, appreciate the great things you have in your life. And the other reason I left this great little guy in the background is that's my daughter. And to remember that we're all human, and we need to enjoy those things and people that are around us the most, so we can continue to give back after replenishing who we are as a nurse, and in my case, as a leader. So I hope you guys have enjoyed my presentation, and I look forward to learning more about each one of you.